So Selena Aglo here with the Way to Healthy Living Center. I'm super excited because Dr. Christy, who's actually been here, crazy Dr. Christy, since 2017. Does it seem like it's been that long and that short to you?
No, I was kind of shocked when I realized that as well. It's surprising how time has flown.
It's been amazing to have you here. You were a wonderful addition to the center that long ago, that short ago, I'm going to say. And Dr. Christy, like COVID for so many people, unfortunately, has kind of struck in their business. But here at the centers at 4508 Zook Road, we've actually grown, got a little bit more educated, and also added to our services. So I'm excited to have you here today to talk a little bit about your practice and some of the things that you've added. So Dr. Christy, can you tell me a little bit about yourself and Still Medicine?
So I'm an MD, but I did a fellowship in osteopathic integrative medicine. So I learned a lot of the manual medicine techniques and mindset from the DOs, as well as I learned acupuncture, medical acupuncture, and I offer what I call personalized medicine consultations. So for patients who feel like they've tried everything and they still feel like something's not quite right, and but all the tests have sort of come out negative, that's who I tend to see. And people who are also tired of like having multiple diagnoses in different systems, we try to look at you as a whole, kind of all the things that affect your health, and instead of looking at you as your like gastrointestinal tract and as your respiratory tract, and your brain, we kind of try to see what are the common factors that are maybe influencing multiple areas, and start looking at those and trying to affect those from a lifestyle focus first, but also using osteopathic medicine treatments and acupuncture to along that journey.
So speaking of acupuncture, one of the things that you've really grown to offer in your services is something called Battlefield Protocol. And I know we've talked about it, and I actually have individuals who have experienced very promising results. So can you tell us a little bit about Battlefield Protocol, knowing that many people, when they hear acupuncture, they actually think of like those little stuffed dolls with lots of needles sticking out of their body, and they're like, oh, I'm afraid of needles. And then I actually, in my car, sometimes I carry an acupuncture needle, and I'm like, see, they're tiny. It's harmless, and you're going to feel better. So tell us about why Battlefield Protocol, who is it for, and what is the experience going to be for them?
So it's called Battlefield Acupuncture because it was designed by the military, actually. I mean, acupuncture has been around for millennia, and they've used needles on the ears in China for many years, but this particular grouping of 5 points on each ear was designed and put together by Dr. Richard Niemsau, who, when he designed it, was a radiation oncologist for the United States Air Force. And it works incredibly well, especially for pain, both acute and chronic pain. But we've also noticed that it seems to help boost mood, so decreases anxious moods and it improves depressive moods. So the reason I have been doing this for a while, I've done thousands of patients at this point with Battlefield Acupuncture. But the reason I wanted to start to offer it as a separate service is because of two things. So one, a lot of people are kind of concerned and afraid to try acupuncture, and I can understand that. And the idea of having needles, and sitting there or lying there with needles on you can be a bit intimidating. But this, you can stay fully closed, you can be seated, and it's just going on the outer ear. And the second is I wanted to provide something very affordable and effective. So I work part-time at the VA, and I'm not an official spokesperson for the VA, but my personal experience, what I can say, and that of my colleagues, is that we see a very high response rate to relief and improvement with this protocol. And there we've done it in groups, prior to COVID at least, and we've just started groups back again. But you can offer it, it's very quick, and because it's so quick, it can be very affordable. And I know a lot of people been wanting to try it, but might be intimidated both by cost and what it is. And I just wanted to offer something that I feel is highly effective and make it more widely available to the public.
And so, in that offering, you're actually running a little bit of a special that they can learn more about at your website, stillmedicine.org, in terms of what services you offer. But your special itself, can you tell us a little bit about that today?
All right, so yeah, thank you very much, Selena. So the special is going to go through the end of the month, so through May 31st. So the initial visit, so there's two parts. There's an initial visit because I do have to make sure as a physician that we have to go through what we're treating and make sure that it's been evaluated appropriately, that I'm not just using acupuncture to cover up pain inappropriately. And so there is an initial visit. It's normally $120. I'm doing that for $78 right now. If you hit the button and schedule, it can happen after the 31st, but as long as it's booked by the 31st, you get the price. And also follow-on visits are going to be, instead of $70, they're $35 for a treatment. And as long as you start with me, you maintain that price. That way, $35 is less than or equal to most people's specialty copay. So even if I don't take insurance, but even if someone did take insurance, that's probably at least, if not less than what you would pay if you saw somebody who has insurance to get acupuncture.
And so a lot of people, and for lack of a better word, I don't want to say one and done, but a lot of people, this is individually focused, correct? And so when they do sign up for that initial consultation meeting with you and they're thinking, oh, this is going to be like 6 or 8 or 9 or 12 visits or whatever, it really is dependent upon their response rate. But it was interesting, you and I were talking earlier, and you said some studies even show that the more chronic and severe, the better the results. So what can people expect? Like when they come, should they, or how can I say this? Do they look at it as it's a consultation and she's going to tell me what I need?
So,
right?
Right. So it's a brief consultation focused really on the appropriateness of this procedure for you and an initial trial of it. It takes a little longer because I like to go slow and make sure that you're comfortable with it. If you have any questions that come up, we can answer them at that time. And of course, you can ask them later on as well. But I want to make sure you're comfortable with everything that's going on. So it's the initial consultation. We do the trial, and what's interesting is when they've done studies, they say it's about 80 to 85% effective. I would say that's about what I see in clinical practice, at providing anywhere from a little bit to a tremendous amount of relief. What's interesting is that several studies have shown that the more severe your pain, the more likely you are to have good benefit from this. So now in terms of frequency, some people have had like a single treatment and they don't really feel like they need to come back. Most people do feel like they need follow-on treatments, and that depends on the person. So what I tell people is, it can last anywhere from minutes to days to weeks to months. And so everybody's different. If you have any benefit, then they've shown that each time you get it, it tends to last longer and longer. So we've had patients who've had to come in twice a week, who are now out to once a month, and who've had really severe injuries. So we're maintaining them on battlefield. But not everybody even needs to be on it long term.
So how fantastic it is, especially as we all grow concerned with the opioid epidemic and just the solutions out there for treating chronic pain. But boy, with COVID, anxiety and depression are rampant. And so I think it's amazing to hear you say that not just with chronic pain, but also with some of the mood disorders, there's improvement. So like you said, for something that would basically be our copay at a specialty office, it's certainly worth an opportunity to look at as a great solution for all.
Yes, yeah, they've noticed that when people's mood tend to improve. So again, decreased anxiety. People are generally more calm and relaxed afterwards. So I mean, in general, a lot of people when they get acupuncture fall asleep during the treatment. So it tends to be very calming. Sometimes people describe a sense of well-being with it. So I would have to say, I do have to clarify, I don't take insurance. It's cash pay. Also, I unfortunately can't see anybody with Medicare, so 65 and over, as much as I would love to see you, because I do not take insurance, but also I am not what's called opted out of Medicare. I cannot see you unless I opt out, and I can't opt out because I also work as a federal employee with the VA. So I apologize. I would love to see you, but
However, what's exciting is if you do reach out to the Way to Healthy Living, we have other practitioners,
absolutely.
other resources for you. So although Dr. Christy is asking you to reach out to me directly if you're 65 or older and interested in knowing more about solutions like this, we may be able to connect you with someone else. But truly and absolutely, I've seen it myself, friends, worth a visit with Dr. Christy. You can schedule directly at stillmedicine.org. Dr. Christy, thank you for being a longtime practitioner here at the Way to Healthy Living Center. It is an honor to be in your presence.
Thank you so much, and thanks for having me here, Antonina.